I'm really honored to open our Milano Congress here in San Raffaele Ospedale.
E qui a Milano oggi discutono insieme alla nostra organizzazione nazionale di tematiche che sono al centro dell'agenda politica sanitaria non solo italiana ma europea, come quello della sostenibilità, dell'invecchiamento della popolazione, delle nuove prassi, della capacità di integrarsi sempre più con i settori nazionali a fronte di una diminuzione della spesa del welfare più o meno tendenziale in tutto il mondo occidentale in questa fase di crisi. Quest'anno la legge di stabilità, nonostante il periodo difficile che c'è stato negli ultimi anni, vuole tenere conto del settore privato e interrompere, come già avvenuto almeno dal 2013, questa tradizione non bella dei tagli lineari e in particolare tagli al settore privato, proprio perché il settore privato insieme a quello pubblico devono costituire una parte, un insieme che deve erogare sempre maggiori servizi e di più alta qualità al nostro cittadino. Noi stiamo lavorando sulla produttività del settore pubblico, stiamo lavorando sull'appropriatezza nel rendere le nostre strutture ospedaliere sempre più efficienti. La stessa cosa vogliamo dal settore privato, cioè in modo che questi due ambiti possano integrarsi in modo complementare sempre di più, rispettare standard qualitativi sempre più alti per offrire un servizio, questo sì, pubblico e universale ai nostri cittadini, sia che sia gestito o erogato dal settore pubblico, sia che sia gestito o erogato dal sistema privato.
Io sono il Presidente della Commissione Ambiente, Salute Pubblica e Sicurezza Alimentare del Parlamento Europeo.
And our aim it is to continue to guarantee to all European citizens better access to high quality healthcare in cooperation with a member state and with you that represent the professional committed day by day towards this need. In conclusion, ladies and gentlemen, I want to ensure the cooperation of one of the legislative institutions, the Parliament, that after the Lisbon Treaty is going to make the legislation with the Council. What does it mean with a 28 member state? To cooperate to have a more efficient, a less costly and a better healthcare system across Europe. And we are ready to cooperate with the private sector because we are deeply convinced that private is a strong power for supporting a better healthcare system with less cost.
Health system in Europe are very important because they serve all the people. We must go on in this way, don't stop invest and be careful because the crisis was a very great problem. And it is important to avoid the diminution of investment that could determine a problem on the health of all the people.
To start working now, and actually the Commission and in Europe is already working since 1997 to the concept of sustainability, how to become sustainable, the future, how to keep the social model, the European social model stable. I believe that only working together, public and private, politicians and researchers, we can find a solution.
This is the first session of the Congress, and this shows the importance of the subject for the modernization of healthcare systems in Europe.
My name is Jens Wernick. I'm a lawyer and representing a private hospital based in Munich, Bavaria, and we are a member of the German Association of Private Hospitals. And in this position, I'm representing the German association within UEHP.
Just one issue, one more thing here about the hospitals, because there is a wide discussion around in Europe about whether they should be private or public. In some countries, the debate is that if you have private hospitals, then you will not have universal and equal access. For me, this has got nothing to do with that.
My name is Andrzej Sokołowski. I'm president of Polish Association of Private Hospitals. We are members more like 10 years in UEHP, and we come to Milano, to this Congress, to see what's happened in the private sector in Europe and what was in the future.
UEHP in Brussels, we cooperate with the European institutions, the European Commission.
We are here representing the European project that has been funded in 2013 by the European Commission. It's about management of healthcare waste in facilities, hospitals. We are hosted here today by the European organization, and we would like to leave them a message in order that our project will become implemented in European guidelines.
My name is Kenneth Kronehage. I'm from Falck. It's a Danish-based company with international activities in 47 countries. We operate emergency ambulances.
Patient and professional mobility are key aspects to delivering the citizen-centric care that we believe everybody in the European Union deserves.
The European Commission is working on that together with all the European stakeholders, actors, including the private hospitals, to transform this into reality.
So you see that on average something like 3.7% in fact of EU citizens answer that they have in the past 12 months an unmet need for medical attention for these three main reasons: so waiting times, distance, or cost. In fact, in the lowest performing countries, this number is closer to 15%.
But I want to acknowledge, particularly today, at a time of significant crisis on our borders, the commitment, the care and the compassion of our colleagues in Italy and particularly in Greece.
I think it would be nice for you, I believe, to hear the point of view of WHO on a number of matters. And our policy at the moment, which is the so-called Health 2020 policy, which is based on these 6 boxes and 4 pillars and 2 strategic objectives.
L'hospitalisation française, nous représentons 300 000 collaborateurs et médecins. L'hospitalisation publique, 1 million. Nous prenons en charge chaque année 8 millions de patients, dont 3 millions en urgence. Donc c'est une part importante d'activité au sein du territoire français. Également, en termes d'efficience, il est important de rappeler qu'avec 17% des financements, nous réalisons 34% de l'activité.
I think it's a very important step for us to be more recognized, more visible at European level, and now to have to define the best cooperation with other actors. I mean medical doctors, nurses, patients association, but industries too. So I think the objective of this Congress was to find the right balance between regulation, efficiency and quality of care, and I think our position was really positive and accepted by most of participants. I hope we can go further with our team. I think now it's a time to New Deal and to improve the position of private sector in Europe of health.